There you go. How are you?
I'm good. How are you, friend?
I'm doing well. It's so good to see you. It's always
Oh,
always a delight to get to see you, Leila. So thank you for joining us today.
I'm happy to be here. Looking forward to the conversation.
Yeah. Well, today we're going to talk about COVID, and I know that in a lot of ways we're all tired of COVID, and we have COVID. What's come to be known as COVID fatigue, I think, in the world around us. But students are very concerned, about COVID and about how it's affecting the admissions process. I will say that we did a Inside Med Admissions a couple of months ago about COVID, an hour-long conversation with Dr. Harrison, as well as a couple of other admissions deans from around the country, and that was a great exercise. You can find that on our YouTube channel and see a lot of the responses that were given there. But before we get too much into COVID, I do want to give you an opportunity, Leila, to kind of tell us a little bit about yourself and where you are and what you're doing and what your role at your school is. And why don't you tell us a little bit about yourself?
Sure, happy to do that. Hi, everyone. So glad that so many people are joining for this awesome event today. So I am Dr. Leila Harrison, and I am the Senior Associate Dean for Admissions and Student Affairs at Washington State University Elson Floyd College of Medicine. We're a new medical school. We just graduated our inaugural class. Yay to that. And so that's a big woohoo for sure. But I've had almost a 2-decade career in medical education. Much of that experience has been in medical school admissions. This is the third medical school I've worked for. I worked for both MD and DO programs across both in the southern and now western region. But in addition to that, I am pretty heavily involved nationally with the AAMC and also some new ventures with the ACGME, which is the accreditation body for residency programs. But in all, my experience really is heavily focused in admissions. I really love holistic review. I am involved with the AAMC in conducting holistic review workshops for medical schools and also residency programs to help them develop holistic selection processes. Enrollment management principles, and just other aspects in terms of doing a good job about of selecting the right candidates for a program into it. And then now in my role with student affairs, once we get them in, supporting them through the 4 years, and then supporting them in the residency applications and match process into residency. So the full gamut.
So you're a busy lady.
Yeah, it never ends, right? There's always something going on, which is good.
Right? That's funny. Well, we all know that the COVID has really affected things. It has shut down the world around us, and it's made it a much more difficult process. In a variety of different ways. And so I'm wondering if you can just give us a brief overview of how has COVID affected your school and how is your school responding to COVID?
I think about our school specifically, and I know this was not unique to us by any means. I mean, the impact when COVID hit was certainly our students that were in clerkships having to be pulled out of clerkships. And, that was a pretty significant impact. I think that third-year students across the country and fourth-year students were facing last year. And then just kind of weathering through that when they could re-enter the clerkship space. And just helping, do what we can to support students through all the stressors that came with COVID. And then the onset of the vaccines and in ensuring that they had access, when you had to get a vaccine, given that they were treating patients and taking care of patients. I think that, and then of course, I think all of us have personally been impacted in our work and our personal lives, but working from home since last March has been an interesting change in terms of supporting current students. And then when you think of applicants, I mean, just hearing consistently across the country from our colleagues and applicants that we talk with about the barriers to gaining experiences for their upcoming applications, concerns about getting to know their faculty well enough to ask for a letter of recommendation, concerns that they're not getting exposure to the profession to have a competitive application, and so on. You know, a lot of these unknowns and these new things that I think we're all encountering because of the pandemic. So.
Absolutely. Well, let's jump right into some of the specifics about this, about how medical schools are responding to COVID, and obviously one of the biggest ways that initially had to be dealt with was the interview process. And tell us a little bit about how that has changed, how COVID has changed how you're interviewing students.
Absolutely. I forgot about that one in the midst of all the things, right? So that was a big change that last year that occurred that I think we're going to continue to see into this cycle. We couldn't expect, there was really no traveling happening last year, and we couldn't expect for applicants to risk their safety and health to travel for interviews. So I imagine all the medical schools transitioned to virtual interviews last cycle. And I would venture to say that the far majority of them will continue with a virtual cycle this upcoming year. And it was an interesting shift because we had to figure out, it's a big deal for a medical school to bring applicants to its campus to be able to say, look, you could live in the city. These are our facilities, meet our people in person. To shift all of that to occur virtually, was not easy. And I think for schools where they do bring in the majority of their medical students from outside of the city, having to sell your city, having to sell what you have to offer, it's not always easy virtual. So, and then outside of that, the assessment process, right? Doing interviews via Zoom for the most part. I think a lot of people use that platform, or they use other platforms to conduct their interviews. We, in a traditional or normal process, we used multiple mini interview process, and we attempted to do, not attempted, I shouldn't say attempted. We actually, my team, and this is not me, this is my team, conducted 2 MMI interviews for pathway programs last summer and realized it's already resource intensive in person, but it's very hard virtually. And so we had to shift our interview modality last cycle, and then thinking about how we're going to shift again for this cycle and adapt. So a lot of shifting, but I will tell you what is really neat about this is that, one, I think it was the right decision, besides the health factor, to conduct virtual interviews, because it really sort of, I think, in some ways created equity in the process. I think there are still some issues of inequity we need to be thoughtful about, but it allowed applicants not to have the financial burden of traveling for interviews. I think they could take advantage of more opportunities that came their way in terms of interview invitations, where maybe in other circumstances or situations they may have had to choose which interviews to attend because of finances. So I think in that regard, it was really helpful, but it also forced us to be thoughtful about circumstances that applicants might be interviewing in and that may have no control over, and that shouldn't factor or influence our decisions about them. So I think there are silver linings that came from this experience, and a lot we've learned through it.
Yeah, absolutely. And do you anticipate, I mean, you sort of addressed this, do you anticipate that this current cycle, the 21 cycle, will be virtual interviews for most medical schools?
I think quite a few of us will continue that way. I think, and I think that could change. It could shift as we continue to receive good news in terms of the pandemic and health status and so on, that as we get closer to the interview cycle, that potentially some medical schools might say, you know what, we're going to go ahead and shift back to in person. But I think that there are a good group of medical students that are saying, medical schools that are saying, this worked really well. There were some really good things about this. We're going to continue down this path, this cycle. That is definitely the case with us. And I definitely have spoken with a good, group of colleagues who are following a similar approach. But I do think that there could be shifting as the summer progresses and we know more. But I would venture to say that a good, I don't know, it's hard to put out numbers, right? But, you
Right.
know, a good amount of the medical schools will continue with a virtual cycle this year. I think, Dr. Wright, one of the other things too that is interesting, not to say that this necessarily influences what medical schools do, but you know, there's comment too. The residency programs have not yet decided whether they'll have a virtual cycle or not, and it'll be interesting to see. You know, because it's the same process. It's just 4 years later, but to see does that have any influence?
Yeah, absolutely. So as we go along, I'm gonna begin integrating some questions from the students in, and one of them really relevant to what we're talking about right now is this question: what sort of things has your school done to ensure that students get a good sense of the school culture? Are there virtual tours, speaking with current students? Is that still possible, et cetera? So tell us, I mean, this is, you know, a big issue, I know, for the medical schools as well as for the students in terms of trying to figure out, is this a good fit for me or not? So talk a little bit about that.
Right. I can't imagine moving to a city you've never really been to before because you got into their medical school. I know that must be difficult. Yeah. So like for our program, we really wanted to be thoughtful about that piece that let them get to know us truly the way that we are if they were here with us in person. I think our interview day, the way that we set it up, in and of itself really set the tone. We heard from applicants consistently that I really got a good feel for this school. I got a good feel for the people. But we also created an online resource page where we did develop virtual tours of the facilities. We also engaged our current medical students to develop a tour based off of a student perspective, the kinds of things and the places that they hung out and the resources that they used on campus. And it was all narrated by them. So it was, you know, from their lens, which I think was really neat. We have virtual office hours. We have virtual tours are a possibility. We're always willing to connect with our current medical students. We developed more mini webinars to put online. So just really, it forced us to develop a lot more resources to help applicants to get a good sense of who we are. And I really, from the feedback that we got from our applicants and then those that are coming into the class, I think that they did get a good sense of who we are. I think that these things that I'm listing out for our program aren't uncommon. I think medical schools across the country, you know, develop these resources and more even.
Absolutely. You know, it really kind of caught everybody off guard. I mean, it was not, you kind of had to really switch on a dime in terms of figuring out what are we going to do to make this happen, because everything kind of shut down right almost as the cycle was beginning to get started last year. And so kudos to you guys for just everything that you did to make it all happen. It must have been pretty crazy.
You know, yeah, for sure. I mean, it was, you know, the AAMC developed a new tool last year that we utilized in our process called Vita. So having to work with our programmers, even of implementing that into the program that we use to assess in our interview day, you know, even background changes like that, to just strategizing on what do we need to do, how do we answer questions that applicants are going to have. It was a whirlwind. I'm amazed not only with applicants and their ability to adjust and kind of roll with things, but also the resilience of the medical schools and the admissions teams and adjusting so much as well.
Yeah. A lot of we're getting a common theme on some questions right now in terms of what do you see as good as coming out of COVID? And you know, you addressed this a little bit previously with, you know, the lack of finances with some students had, and that the virtual interviewing really made an impact on their ability to interview at schools. Are there other things that you see that have really made a major impact? And I guess this even goes to addressing you're putting your student affairs hat on, you know, the things that your current students are having to do. How has that impacted, you know, the curriculum, the what the students are doing that are already in medical school. Seemingly, there's some positive things that have come out of this.
I think without a doubt, I think we do need to look at what I call them the silver linings of the pandemic, right? What things were we forced to adapt to that ended up being really good changes? I think we became more proficient and better at communicating with our applicants. I sent way more correspondence, I think, to our applicant pool this cycle just to keep them informed, updated. I think also, I believe we're always empathizing with what it feels like to be an applicant in this really hard process any year, but really forcing conversations, healthy and good conversations among the medical schools about these circumstances, like what a bias, for example, what we need to be really thoughtful about how external aspects about an applicant that they have no control over might be impacting our decisions. So, more training and of our interviewers of they may not control who's walking in the background of the room or that their dog's barking or, different things that are, or frankly, we had applicants who were interviewing in their car, or because that was the only quiet space that they had. And there's nothing wrong with that. And really helping to shift sort of the expectation in this space or in this context of medical education about what is appropriate and what is the right thing to say. Not everybody has the same access or the same options, and that shouldn't matter in their interview. And so I think silver linings are maybe greater, but also just different lens in terms of bias. I think the virtual process, us wanting to continue that here, not only because I think it does help with equity in terms of applicants not needing to worry about traveling to us to interview, but I mean, the truth is that this pandemic has also put a financial crunch on institutions, and we saved a lot of money not having applicants have to come to us to interview. And, I think that is a real consideration for some programs. So, and I think the resource page, we never had an online resource page before where we recorded interviews that or videos and collected a lot of different information that we provided to them prior to the interview. That we never did that before, and we're like, this is great. This is and we were able to use that for like second look. And once we accepted, but when you accept an applicant off the wait list, it's been months since they interviewed. You can refer back to their information. And Dr. Wright, I'll tell you another really exciting thing that it didn't necessarily come from the pandemic, because this idea came to us before this. But it has served us so well in the pandemic, and that is our students from the Student National Medical Association, or SNMA, had come to us probably late 2019 and said, we want to provide mock interviews for all the applicants that are invited to interview at our medical school. It's totally student-led. And they developed a program, we call it the CAMI Project, and they developed a program whereby every applicant that we interview, we offer them to do a mock interview with our medical students. And the medical students totally lead this. They arrange this, they train, we help train, but they train every student that wants to be involved. And in particular, they bring in not only SNMA, but students from our other different identity groups, other ethnic or racial identity groups, LGBTQ plus student organization, non-traditional students, military medical students, and so that the applicant can select which of those student groups they would want the interviewer to come from. And it's a way also to show the applicants, like, I identify with this group, and so that's somebody I want to do a mock interview with me. And this is amazing. More than about half of our applicant pool that we interviewed participated in a mock interview. We had over 80 medical students across the 4 years that were mock interviewers. And this is a project that's going to continue. And they did it virtually, right? And so you're going to have a virtual interview. Let's do a virtual mock interview. And often, when applicants are doing mock interviews, they'll choose somebody that's comfortable to them, somebody they know, right? Because it's too scary to go ask some random stranger to do a mock interview, right? Or a professor or something. Well, this simulated that experience. Your interview is going to be with strangers, and these students are strangers to them. So I think that also assisted. So that was a cool thing that came out of this too.
Oh wow, what a awesome program. That's,
Yeah.
I mean, kudos to your students for
They're amazing.
thinking about that. That's really incredible. That's really cool. Tell us a little bit about how your admissions committee, the lens that they're using to view, for example, shadowing and clinical exposure. This is a very chief concern of many applicants, is that essentially for the entirety of 2020 and for many of them still now in 2021, the opportunities that they have to find shadowing experiences, to find clinical experiences are very limited. And how is your admissions committee, and I'm sure you've had colleagues around the country that you've discussed this with as well, how are medical schools, really adjusting that lens that they're seeing applicants through, knowing that there may be a limitation on what the applicants have been able to do?
Yeah, and this is, I think, the one place, one of the places that I really empathize with applicants, because it's really stressful when you have no access. I mean, if we're having trouble getting our first and second years access to the clinical space, it's definitely impacting their pre-meds. In our program specifically, we don't have any specific, like when we talk about healthcare, when we want to see healthcare experience, it doesn't have to be a certain kind of healthcare experience. It doesn't have to be shadowing. It doesn't have to be hospital volunteering. It can be being a care provider for a family member. That we look at that positively. We don't require a specific number of hours. So I think for us, we already had some flexibility built in to allow us to be thoughtful. But I think this coming cycle, even more than last cycle, we're going to see even a bigger impact in applications regarding this aspect. I think that, one of the hard things on the side of the medical school is that often the reason the requirement exists to have healthcare exposure is that we want to make sure that you have some sort of informed reason and some sort of exposure to inform your decision to pursue medicine. You're not making this into this, it's the perfect career. You watched Grey's Anatomy and this is why you want to do this career kind of thing, but that you really kind of have a grounded idea. And granted, you're not going to always get that grounded idea just by shadowing or volunteering in a hospital. I think that medical schools are definitely having these conversations about what are applications going to look like and how do we need to be flexible. We're also going to see a variation, right? You're going to see the reapplicants or the more non-traditional applicants who have had the ability longer term to gain that experience versus traditional applicants who are juniors in college right now that are applying in their senior year and have probably had fewer opportunities. So I think that, virtual experiences, I think a lot of medical schools are, if not all of them, are going to be thinking about how to be open to virtual shadowing, virtual experiences, conversations with physicians, other kind of creative ways of at least just showing that you have made an informed decision, talking about it more in depth. I think this is where it's really important for applicants to get into the research literature, inform themselves about things like social determinants of care, about how the pandemic itself has impacted different populations, health disparities, just like start to inform themselves about the deeper level aspect of health, so that even if they haven't had a lot of exposure, they're at least informing themselves in these other ways as well. So I think there are those things. I think the other thing that I get concerned about is that there are, hospitals, clinics, and probably other entities that are creating paid virtual shadowing or paid healthcare experiences. And that's really concerning to me because it really then further sets apart groups of applicants, whereas not everybody is going to be able to afford those kinds of opportunities, and medical school should not favor those that can. We really need to be thoughtful about equity and access. And so I think we're going to probably see more of those kinds of things coming up, and we won't necessarily know that they were paid experiences, right? Because I don't think that that's not necessarily going to come up in the application, but we need to be thoughtful that if applicants, those that had access and those that did not have or let me put it this way, those that do not have experiences on their application, but they're able to really kind of, in a dialogue and narrative, talk about what their understanding is or their own experiences. We need to be careful about favoring those that have the experiences in the most recent year in the pandemic, and why that is, and the access that might have been there, and conversely, those that didn't have access. So we need to be careful and thoughtful of that.
Absolutely. Absolutely. It also emphasizes, it seems like in my mind, not for everybody, certainly, but don't wait. In other words, if you're a freshman in college, don't wait. You know, you never know what's going to happen. You know, when you have opportunities, take the opportunities. You know, begin early and do it throughout your experience. And you know, I think what many of the pre-meds that we're dealing with now, they waited until, you know, that junior year, and we're expecting to, you know, they maybe had something lined up for the junior year that they were going to do, and it falls through because of COVID, and they're stuck with nothing because they waited until that point. So begin early in your process, I think is a very important point to be made. And you're shaking your head. I'm assuming you're definitely agreeing with that.
Well, I think applicants need to understand that admissions committees look at longevity in experiences as well. If you have just several one-time type things and you're not spending committed time in some, not necessarily healthcare, but any experience, we're wondering why. And absolutely, you should be engaging long-term in experiences, not necessarily all healthcare. It could be community service and other things, but that record in terms of the timeline is also important. You know, in addition to what the experience actually is. So definitely. And the other thing I'll share, Dr. Scott or Dr. Wright, is that I think that, I'm so used to calling you Scott, I'm trying to call you Dr. Wright here.
No, that's all right. Either way.
Is that, you know, the other thing is that, I think sometimes, and I'm speaking more of, I think, the traditional applicant, somebody who is straight from high school into college and is a junior and planning to apply to medical school in their senior year and then enroll in medical school right after that. I'm thinking of more of that kind of applicants. Is that they oftentimes it's this burden or this feeling as though this is the timeline. This is the only time frame in which I can apply to medical school, and you know, they have their life planned out, which is not a bad thing to plan your life. But sometimes I think being flexible and giving yourself grace, that it's okay to shift that. And maybe if you're in that situation right now where you really are not going to have a whole lot of experiences to report in your application, do you want to spend all that money and time in this process? Or is it better to say, back up and say, you know what? I think I'm going to take a gap year or gap years, and I'm going to do some other experiences. That's where I'm going to gain the experiences. I'm going to apply, you know, in a year or two. There is nothing wrong with that. I think it's more of them letting go of that perfect timeline and saying it's okay to do that. I think applicants need to understand, and I feel comfortable, I think, speaking broadly for this, is that medical schools are not looking for one specific timeline for applicants. We're looking for a well-rounded candidate that has experiences that aligns with our mission. Not that we're from high school to college and we're straight into medical school. In fact, like at our medical school, we enroll more non-traditional students. These are people that have had other careers, have been out and enrolled a little bit. So be flexible if that is better than trying to force an application this cycle.
Yeah, I've often said there's as many timelines as there are applicants. You know, everybody's got a story and everybody's got plans, and that's okay. There's no one sort of magic timeline that says this is what you ought to do or should do or whatever. So that's you know, absolutely. Caleb Marsh chimes in and says, "Preach it."
Hi, Caleb.
Exactly. So we do have a good question here, and I think this goes back to the issue of access to healthcare and that. But Trey says, because shadowing and clinical experience is limited, do you think our own personal experiences as a patient, if we were at one long term, would be beneficial, since it shows we've been exposed to hospitals, for example? What are your thoughts about that?
I would say absolutely. Now, I might be speaking more for my medical school on this, but I would say absolutely. I mean, frankly, you might have more experiences by being a patient, especially a long-term patient, and having exposure to physicians and procedures and hospitals and other care contexts than somebody who is shadowing or volunteering in a hospital, right? So you likely have more perspective and insights and understanding of what it means to be cared for, and thus what kind of physician you want to be. So don't minimize that. I would say absolutely, if you feel comfortable, tell medical schools about that. And I really would hope that medical schools would be thoughtful about considering that experience.
Yeah, and we also hear the similar, about caring for loved ones or caring for, family members, et cetera, and how important that it has been in their journey. And they often minimize that because it's not officially clinical, or it wasn't, an official program or something, but something that definitely they should put on their application. Would you agree with that?
Absolutely, because I think when you're in those roles, not only are you caring for your loved one, but you are likely also interacting with healthcare professionals. You're interacting with insurance. You're interacting with some of these other aspects of medicine that I think a lot of applicants don't get exposure to. They don't understand. They're pursuing a career that sounds amazing, and they're this perfect career, and they are not thinking about all of the behind the scenes things that we'll be dealing with as a physician, that when you're in a care provider role or a patient yourself, you're seeing some of those behind the scenes things that you'll be dealing with as a physician. So I actually think it gives probably more of a realistic understanding of what the career entails. I think also, you have a lot of applicants that have family members that they serve as interpreters for. Now, there's a lot of things surrounding that in terms of, whether that's the right thing and so on, but they are sometimes put in that position to have to do that, have to communicate on behalf of their loved ones. And again, they're getting exposure for all of the kind of behind the scenes, or just even what care looks like. So I think those things, I think sometimes applicants, and I think this is not applicants' fault. I think we need to be better as medical schools in being transparent and better describing what we're looking for. But it isn't just that you list a shadowing experience or that you are a hospital volunteer, but that you are able to convey these other experiences that you've had in a way to help us understand what your exposure has been. But some of these things are they're uncomfortable or they don't want to share them, which is totally okay too.
Absolutely. Another issue that comes up quite a bit is the pass-fail issue with schools having gone to pass-fail for some period of time. And some schools are still in a pass-fail kind of mode, or they give that option to students. Give us your perspective from your institution and your admissions committee on how this is viewed. Should students, if they're given the option to do that, should students become concerned about that? What are your thoughts about the whole pass-fail option and how that's going to affect their application?
So for our program, immediately when COVID hit last year, our admissions committee said we accept prerequisites and coursework pass-fail. So and we do specify the semesters in which we say that that's approved, because our prerequisites, for example, they do have to be graded, but in this time we said they can be pass-fail. And we did learn, through that from pre-health advisors that in some cases, students did have the choice about whether they took a grade or not. The thing is I think that, just across the board, we accept it, pass fail, no question. We're not getting into that detail in the admissions committee meetings. We're not drilling into that. I think in terms of making the decision, if a student is faced with, do I take it pass fail or do I take it for a grade? I think there are a lot of circumstances that probably come into that and that help inform that decision. And I think they need to make the decision that is best for them, period. I think that medical schools, I know for sure last year accepted pass fail. I think again, moving into the cycle, I expect that would be this, it'll be the same for this coming cycle. So I think, I think if you're doing it because you think it'll be easier, then I would stop in the second, kind of think through that reasoning. If there are other circumstances that it would be more helpful to take a pass fail, then take a pass fail. We're not going to know. We don't ask the question, and MCAS doesn't ask the question, did you have a choice of whether this was pass fail? So we're not going to, the medical schools are going to know the choice part of it. Mm-hmm. So I would say do what's best for you and what is going to set you up best for your medical education. That's what I would say is, if it's because it's an easier road, it's the same coursework, but you don't have to get the A versus the, the C. If it's because it's easier, I would stop and think through that. But if it's because you have other circumstances, then do what's best for you.
Yeah. And we have had students who ask the question, where they have a situation, let's say they're taking 4 classes and they choose the graded option for 3 of the classes and pass fail for 1 of the classes. What does that say to an admissions committee who is this something that, could potentially come up in an interview? Why did you choose pass fail for that particular class as opposed to the other classes which you got graded? Does the admissions committee, do the interviewers get that granular in their questioning and in their, in wondering about that kind of stuff, or is it higher level than that?
For the medical schools that do sort of an open file interview where they would get that information to begin with, it's possible. I definitely in processes I've been with before where they did have access, they might drill down into specific classes and might ask the question, tell me about why this one is pass fail and this one, these are graded. And so I think that, first of all, I think applicants need to look at the schools that they're applying to and ask the question. You can email the admissions office if it's not clear about how interviews are conducted. And if they're open file and they would have that information, they should be prepared for that. Be prepared to answer honestly. But there are many of us as medical schools that do closed file interviews. Like in our process, they receive no aspect of the application to make that decision. So it wouldn't come up in the interview. If it were to come up in the admissions committee, I think this is where us as admissions deans, it's important for us to train our admissions committee members. Like I would tell our admissions committee members, we cannot assume whether or not the student had the choice to take that pass fail. So we should not be making any judgments based off of that. Take it as fact as it is and move on. Like don't assume that they chose. It could be that class specifically didn't have a choice. So, I think we need to not make assumptions about students' decisions like that.
Yeah, absolutely. I think that's a good point. Couple other questions. This is an interesting one, particularly related to clinical experience. This particular Atalia says, I switched from vet med to instead to go to med school. I have lots of clinical experience in vet medicine, but I'm lacking in clinical experience with people. How will this be considered along with the pandemic?
Yeah, great question. I think we see these types of questions when it's related to like pharmacy tech, nursing experience, so other health professions experience more so than like with physicians. I would say I think it's still relevant. You're still understanding, learning about procedures. I mean, and veterinarians still interact with people, right, that are the owners of their patients, and there's still empathy. And how do you talk about a diagnosis in a way that the fur babies parents understand, so I think that there are still relevant crossover there, and I think you should consider it. Now, for just like in the situation with Atalia and others that are maybe have had heavy exposure in other health professions, or maybe are career changers, you'll still need to be able to adequately explain why you're shifting from vet med to medical school. And I think you should be able to do that. And I imagine you can. So, but I do think but what I think, Talia, in this question, what's important is that you make those connections. How the experiences that you had in your vet experiences, how do they relate with healthcare? So don't expect your readers, so us on the admissions side, to make the assumptions. You make those connections for us in your description of the experience, or maybe in your essays and so on. So, but I do think it's relevant.
Yeah, absolutely. Absolutely. I think we have time for maybe one or two more questions. Talia had another one based on Trey's previous question. And that question was about the personal experience with medicine as a patient. Where would we put that in our medical school application, whether it was our own experience or a loved one? Your opinion on that, Leila?
Oh, that's a good question. So let me tackle the loved one first. I think the experience with a loved one could easily be listed as an experience in the experience section of the application. I feel like you could list the dates, you could list the hours, those kinds of things. The personal experience, I struggle with whether or not the most appropriate place is listed in the experiences section. I think, now kind of, on the cuff thinking about this, I think that's better described in a personal statement, but really being detailed in there about what you've learned to support your motivation. Because if you list it in the experiences section, it feels a little bit off there. Like it doesn't feel like it translates as well. But absolutely talk about it in the personal statements with enough context to help us understand what kind of exposure was this, how long are we talking about here.
Right. Right. Yeah, absolutely. Absolutely. So we've sort of covered some of these questions before. Nina has one. And this really goes back to the question about, in terms of your experience with the virtual interviews. You really talked about how you were impressed with the ability for your admissions committee to glean the information that they wanted that they needed from the virtual interviews. Do you see this going forward? We talked, I think, a couple of months ago during the Inside Med Admissions about how some schools are even considering a hybrid where they might give students a choice of whether they wanted to actually come to campus or do it virtually. Is this kind of fraught with danger signals, or do you feel like that this is a good option?
So when you're talking about applicants having the choice between doing a virtual interview or an in-person interview, I do think that there are issues with that because of comparability of the assessment process. I worry that there might be implicit bias or other things that come into play that could impact applicants in one way or one mode or the other. And I've heard, in my conversations with colleagues, have had the same concern. Like if you start off virtual, carry the whole season should be virtual kind of thing. Now, when it comes to having experiences where we interview virtual and then offer opportunities to come to campus as like a visit, a second look kind of thing, which I think, many medical schools are talking about. That's a little bit different. And I think in those cases, they are talking about that being an option. It's optional to come to campus. Now, one of the things I think medical schools need to be thoughtful of and be transparent in their communication with applicants about is that if they offer the virtual if they have the virtual interview experience, but then they offer the optional follow-up in person, is that they convey whether or not that optional in person does have an influence in the decision making. Because if it does have an influence in the decision making, they really should be transparent with applicants about that. Then it's really no longer optional, right? If it's optional, truly optional, it should have no bearing whatsoever on the medical school's decision making. And they should communicate that clearly, because I can imagine on an applicant side, you're thinking, okay, I interviewed virtually and now they're inviting me back as this optional visit. If I don't go because I can't afford it, am I going to be jeopardizing my opportunity there? They should not be put in that position. We should be transparent about what we expect.
Yeah, absolutely. Well, we've reached the end of our time together, and Dr. Leila Harrison, I just wanted to tell you that we are so happy for you to be here today. It's always a joy to get to see you and interact with you. And one of these days, I'm going to make it up to Spokane and see you. And
please.
Yeah, absolutely. And but thank you so much for being here today. It was wonderful to interact with you, and I'm sure the students enjoyed and were really benefited by your comments and stuff like that. So thank you so much, and we'll catch you sometime soon.
Okay, thank you so much for the opportunity, and best wishes to all of you out there going down this path.
Absolutely. Thank you.